New tonight, blood test results released today from northern Kent County, where Wolverine Worldwide dumped PFAS sludge for decades, found higher than average levels of some types of the likely carcinogen.
Target 8 investigator Ken Kolker, who has covered this PFAS crisis since it began, is here now with what it means. Ken?
Brian and Emily, state and county health officials in 2018 and 19 tested the blood of more than 400 people with contaminated wells in Plainfield and Algoma townships. They weren't surprised by the findings. Scientists compared PFAS blood levels in northern Kent County to levels in the blood of the average U.S. resident. They found higher than average levels of two types of PFAS. But the study found that the levels were not nearly as high as those who live in other hard-hit areas around the country. The state and county invited people to get their blood tested if they lived in the northern Kent County PFAS zones and had detectable levels of the chemicals in their wells. In a similar study in West Virginia, researchers found probable links to kidney and testicular cancers, ulcerative colitis, thyroid problems, hypertension in pregnancy, and high cholesterol. The state says it's now working on other studies to determine if the PFAS levels may be linked to illnesses in northern Kent County.
So we're moving ahead and doing the next step in the public health investigation and doing the two health studies that we're also will come to this area that people can participate in, and that will specifically look at is there a relationship between now the high PFAS that we found in the blood, and does that lead to an increase in health outcomes for people that have that level?
One of those studies will also include people who live near contaminated sites in Kalamazoo County's Cooper Township in the city of Parchment. The state says the Wolverine PFAS zone will also be part of a bigger national study.